Joined now by someone personally impacted by the potential loss of those subsidies, Obamacare enrollee in Norfolk, Virginia, Beth Dryer. Beth, I appreciate you being here. I understand you also run an art nonprofit. I appreciate your work. Tell
Thank
us
you.
more about being enrolled in Obamacare. Give us a sense of where your head is at as we see this fight playing out over these all-important subsidies.
Yeah, it's been really distressing to know that the only avenue I have for healthcare may essentially be going away. Right now, I'm paying about $80 a month for my health and dental care. Next year, my premiums could be as much as $425 a
Oh
month
my
for the same
goodness.
plan. Yeah, I did the math last night, and I'm an artist, so I'm not great at math, but that seems to be about 15% of my entire yearly income just for the monthly
I
premium.
mean, what's going
Um,
through your mind as you see that number, more than $400?
it's ridiculous. I mean, I have about an average salary for somebody who lives in Virginia, and I have no idea how I could even start to afford $400 a month for my health coverage.
Mm,
And if I was paying that much as a premium, um, where would the money for copays come from? Because
right.
I'd already been so tapped out that if I did get sick, it would be a struggle to actually be able to see a doctor. It's already been a struggle to be able to afford the copays as they are, but this is just something where I feel like every other industrialized nation on the planet has figured out single payer socialized medicine. And, I bet we could figure it out too. We're just not.
If the premiums do go up that way, I mean, what kind of changes are you going to have to make? How are you going to handle this between personal expenses, other bills in your life? How does this math work out for you?
It just doesn't work out is the thing. I'm not getting a raise next year, so money's already tight. Prices of everything, my grocery bill is going up, my water bill is going up, everything is going up. And if my premium is $425 a month next year, I'm just going to have to cancel my insurance and put money in a savings account and hope that it's enough when I get sick.
Yeah, what does that do mentally? I mean, that's a stressful thought to even listen to.
It's absolutely a stressful thought. When we are sick, it's already one of the hardest
Yeah.
times in our lives. And having that extra pressure of having to pay for the healthcare out of pocket or go into debt because I got sick, if I am sick for long enough, I might miss my rent payment or another payment that absolutely needs to be made. We shouldn't have to choose between rent, food, utilities, and healthcare. We should be able to have healthcare without going broke.
If you could speak directly to the people in power in Washington, what would you tell them about this?
I would tell them that their decisions have an enormous negative impact on everyday Americans, and it's really time to start understanding that they've been elected to represent their entire constituency, not just the Republicans who voted them into office. And they're not doing their jobs right now. And we're out here, we're doing our jobs every day, and we really need help from the folks who we've elected to represent
All
us.
right, Beth Dryer, wishing you all the best. Thank you for your time.
You're welcome. Have a great day.
You too.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.